Now, we are going to learn about antidepressant drugs. Antidepressant drugs. So, these are the drugs which are used in depression. They are used in the treatment of depression. Many people think that depression is not treatable, but it can be treated. I have placed one figure here, one diagram or one picture. You can see the woman is present. So depression is mainly observed in women than in the men. In psychosis, we learned that men will have more psychotic problems than the women. But here we are observing that depression is mainly observed in women. You can see it. Whenever you ask them, they will tell, I am fine. But inside they'll be having feeling, I am nothing to everyone. You can see here, feeling I am nothing to everyone. Let us see what is the reason for this. Clear? Now, you can see it here. Generally, our mood swings in our for us will move from happy to sorrow. So these are the mood swings it can occur. So this is normal swinging of mood between happy to sorrow. For example, we given grades last week. When you have got good marks, you may be very happy. Next professor may come and give next day some marks. You may not perform well there. So you may be sorrow. Now you can see it here. One day you are very happy. Next day or by afternoon, if they given you, you may feel sorrow. This type of mood swings are quite normal. They are very quite normal. Please remember that. If any one side, if it excess, it becomes. Suppose from sorrow to, you observe these sorrow conditions going more days, then it is we call it as mild depression. If sorrowness still continues more than 3 weeks or 4 weeks, like that only, then we call it as depression. So if you make a point like this, mood swings like this, so one side is completely sorrow, one side completely happy. So happiness, if it goes excess, we call it as euphoria. Then if it goes next, it is called as mania. What do you mean by euphoria? False well-being. Patient will feel that he is very happy, but it is false. So imagine, especially these drugs, morphine, cocaine, when they take these drugs, the patient will feel, the person, not patient, the person will feel very happy. He will be in dream state. But when you take these drugs, what happens? You lose control. You may be in the road or roadside, but you still dream that you are in very beautiful place, enjoying lot of things like that. That's why we call it as euphoria, means a state of false well-being. Then what happens is that if this become excess, it is called as mania. If you have one disease, it is called as polar, it is called as either depression or mania. If you have one disease, suppose some patients can have excess mania, then we can tell that he is suffering from mania. is suffering from mania. Some patients can be excessive depressed. We can call that patient as depression. For some people, the swings are too high in a, in a, in a in a 6 months. 3 months they will be very happy. So 3 months they will be very happy. 3 months they will be very depressed. Such persons are called as bipolar disorder. Bipolar, because if you consider this is one pole and this is as one pole. If this is mania, we can call it as is suffering from excessive happiness. If he's suffering from excessive depression, we can call it as depression. If a person has both of these, very happy for 3 months or 1 month, next 1 month he or she will be depressed, then it is called as bipolar disorder. Bipolar disorder. The swings are very, very high. Very high. Mood swings will be very happy, very depressed. So this is the thing. So normal means what? Our swings, mood swings can be between happy to cheerful, happy or cheerful to sorrow. Clear? Even when we lose our parents or someone or friend or something, one day you will be very sorrow, or 2 days. That's all. After that, you will come back. That is natural. Don't consider that I am suffering from depression. If that depression is continued for 1, 2 weeks, 3 weeks, 3 weeks minimum, then we need to suspect. We need to suspect, sir. Both of the characteristics in depressed and mania are completely different. Here the patient, let us see in next slide, we can see that those are things. Here. So here you can see depression is a mental illness characterized by change in mood. Characterized by change in mood. I showed you that pendulum. Consider that our mood is like pendulum. What we were telling here in this diagram. It's like a pendulum. If it swings to one side, depression. If it swings to another side, mania. If it swings both sides, it is bipolar disorder. Bipolar disorder. Now, if that's what we are telling. It is characterized by change in moods. That is a swing in the mood. Loss of interest on pleasure. You can see these are the characteristics of depression. Now, I will tell the characteristics of mania. He will be having excessive interest on pleasure. I didn't put the characteristics of mania here, but I am telling. Please kindly note down. Maniac patient, how he will be? Excessive. He will show more interest towards pleasure. Having nice clothes, spending lot of money. He or she will try to attract more attention towards them. Here, no. Here, that's what you can see it in depressed patient. Feeling of guilty or low worth will be present. Then disturbed sleep. This is observed even in maniac patient. In maniac patient also, the sleep will be disturbed. In depressed patient also sleep. Some people, we written here disturbed sleep. Some people will, in depressed patient, they will be excessive sleeping. Some patient, what happened? They don't get sleep. That's why we didn't write excessive sleep or decreased sleep. We are telling disturbed sleep in depression. In maniac patient, the sleep will be always disturbed. That is nothing but no sleep. Appetite, also the same way, disturbed appetite. In some patients, when the patient is depressed, he or she will eat more than the normal quantity what they, so they put on weight. Whereas some people, they will be very, very lean. in maniac patient, they will be very lean. Here, in depressed patient, you see low energy. Patient will look very dull, but here in maniac patient, excessive energetic. He tries to draw attention by showing its energy. And poor concentration. This poor concentration is the characteristics both in maniac as well as depressed. So this is how depression is described. If these characteristics are observed more than 3 weeks, then we should suspect that the patient or person is suffering from the depression. Now, it can be severe. Sometimes depression can be severe. Even maniac also can be severe and fatal. Even they have suicidal tendency. Both maniac and depressed patients, both of them, you can observe suicidal tendency. Even in psychosis, we observe. Here also, we are observing the what is that? Suicidal tendency. What's the reason behind it? The main reason is that there is decreased levels of serotonin, noradrenaline, dopamine. These neurotransmitters levels are decreased in the synapse, in the central nervous system. So this is the very important characteristic. What is the important characteristics, please? Decreased levels of serotonin or 5-HT, which is called as happy hormone, noradrenaline, flight or fight hormone, dopamine is what's that? The start hormone. Dopamine, we can call it as start hormone. So these hormones, neurotransmitters, will be low in the depressed patients. When they done the research, they found that this is the main cause. So what does our drugs do? Either prevent metabolism or reuptake inhibition. I told you reuptake inhibitors many times. Last class also I was discussing. So in the synapse, their levels will be increased if you stop reuptake. So in psychosis, we observe increased levels of dopamine. So we have used dopamine antagonist. Now in this condition, there is decreased levels of serotonin, noradrenaline, dopamine. So these levels are increased. The levels are increased either by blocking reuptake or preventing metabolism. Let us see outroads we can see when we come to drugs. Now, one more you can see it. The main reason for depression is loss of maternal love. If a child loses his mother or father, usually the person will be depressed. That is one of the main reasons. If maternal love is lost, most of the person will be depressed. Losing a family member, very intimate person, if they lose someone, what happens is that you may become depressed. So family member, loss of job can also be causing depression. Poor education, this is one of the criteria which they observed. Then the person who is having a good education and poor education, they observed that the people who have poor education are suffering from depression, unemployment, socio-economical status. Nowadays, it is changing. Now you can observe females are more prone than men. I don't tell men doesn't suffer from depression, but when you see the statistics, females are more prone to depression than men. What's the main reason here? The main reason for depression is these neurotransmitters are decreased. These levels are decreased. That is the main reason for depression. You can see it here. Whatever we have shown, you can see, observe here. Experiencing appetite changes, I already told, for some few of the persons, they eat more during depression. Few of them doesn't touch, they become very, very lean. When they eat, they become fat. Sleep abnormalities, I told you, excessive sleeping or no sleep. Having low energy, that is quite characteristics. Moving slowly uh, or move quickly, that's also one characteristic. Having difficulty in concentration. Then you can see feeling of depressed, loss of interest, unpleasurable activity, all those, anything, watching TV, mobile, sex, everything. That is what we are telling. Here also, antipsychotics also we told there is libido, decreased libido, here also will be there. Having low esteem, thinking about death. This is very, very, very dangerous. So depression usually affects the mind, but whole body. They try to kill themselves. That's why it is very, very dangerous disease. That's why